Dr. Mulwa, you can give us your preliminary thoughts on these numbers as released by the NDCC. NSDCC.
Thank you. Can you now hear me?
Perfectly. Go ahead.
Thank you. I think my colleague has shared the numbers and the worry and concerns that we have as a Ministry of Health in regards to first new HIV infections. For the first time, seen a 7.3% growth in the number of new infections. Also, increase in the number of deaths. But of importance is to look at where are we getting these new infections. When you look at the statistics, 52% of the new infections are amongst young people and adolescents between the ages of 10 and 29 years. Something that is a concern to the Ministry of Health, and therefore this means is the new epidemic is being driven by younger generation, which probably had not experienced the HIV/AIDS pandemic that was experienced for those of us who are older than 30 years, who experienced the pandemic in its ugly form in the 90s and in the early 2000s. So therefore, it calls for a rethinking or reimagination of the programming. Of course, COVID-19 pandemic is responsible in terms of disruption of services to some extent, where we have not had, we had disruption of supplies of essential commodities, including preventive commodities like condoms in the country, including testing of early infant diagnosis for children, and even for the entire population, the test kits. We have had erratic supply from as a result of COVID-19 in 2021 and beginning of 2022. We had disruptions. So with this multiplicity of factors, it is now upon us as government to align our programming to the current realities that we are facing. Thankfully, that we have been able to work on some of those challenges that we have been facing as a result of COVID-19, and we have restored the pipeline for supply of these commodities. And we hope that going forward with the efforts that we are doing, like the triple threat campaign against new HIV infections in young persons, teenage pregnancies, and gender-based violence, which are the major drivers of new infections amongst this population, we are going to reverse this trend. Indeed, as a country, and in the same report, I think was highlighted that up to 92% of people who have HIV/AIDS indeed know the HIV status. We still have this last mile of getting to the 8% who are HIV infected and do not know their status, because these are the people who will drive the epidemic, and therefore we need to identify them, put them on treatment, and ensure that they achieve what we call viral load, undetectable viral load, virally suppressed, in other words, and this will now effectively stop the epidemic as it is. So it's easier said than done, because it will require not just the Ministry of Health, but a society-wide approach, because you've heard this has everything to do with the behavior change, and therefore it is not just a matter of having the policies right, having the commodity pipeline, having the health system ready, but it's more of a whole society approach. Thank you.